Hello, everybody. My name is Marília Machado, and today I will present my bonus assignment for. I chose this article. It's about maintenance DFMO increases survival in high-risk neuroblastoma. And only for introduction about the tumor, the high-risk neuroblastoma is the most common no CNS solid pediatric tumor, but it's a tumor with high relapse rates, even after aggressive treatments. In the next slide, I will talk about the treatments, but this tumor needs new strategies to prevent relapse after standard therapy. The standard therapy in the high-risk neuroblastoma it's about induction, consolidation, and maintenance. The induction is high doses of chemotherapy, and if it's possible, surgical resection of the primary tumor. In the consolidation, we have the stem cell infusion, and if it's possible, radiation therapy too. In the maintenance, before the DFMO, we use only immunotherapy and cis-retinoic acid. In this part, it's important to talk about the high prices of immunotherapy, and sometimes it's not every place, everywhere can use immunotherapy because the cost it's a very expensive treatment. The study objective is to evaluate the impact of the DFMO as a maintenance therapy to prevent relapse in children with high-risk neuroblastoma. The methodology was a phase 2 open-label multi-center study with 2 strata. The strata 1, it's patients in remission after complete the standard therapy. The strata 2, it's patients treated for relapsed and refractory disease. The treatment is oral DFMO for 2 years, twice daily. The doses depends of the body surface, and the population was 140 eligible patients with 101 in strata 1 and 39 in strata 2. Endpoints in this study is the event-free survival and overall survival too. The estimated using Kaplan analysis and the log rank test used to compare survival between different groups. I will talk more about the statistical analysis and during my presentation, but now I will focus on the study, okay? About the statistical test used, the article uses survival analysis with the Kaplan-Meier method using event-free survival, EFS, and overall survival. The standard errors were estimated using Greek-Wood formula, and the hypothesis tests were conducted to evaluate the effect of coverage using the long-rank test. The association between genotype and survival was tested using a two-sided stratified long-rank test for a trend. About the safety of the DFMO was well tolerated with few severe adverse events, and the treatment is not interrupted for most patients with these side effects. And the most common side effects was transaminitis and hair loss. About the medication, the DFMO showed the benefits in improving EFS and OS, especially in strata 1 patients. And the mechanism of action about this medication is the inhibition of ODC, reducing polyamine levels, which affects tumor proliferation. And the limitations about this study is the single arm without randomized control group, but the further studies are justified. In conclusion, the DFMO is a permissive maintenance therapy strategy for children with high-risk neuroblastoma, with significant benefits, having relapsed and or refractory cases, in both cases, okay? About my justification for the analysis tests, in my opinion, Kaplan-Meier is an appropriate choice to estimate time to event, such as relapse or death in survival studies, especially in severe diseases like neuroblastoma. The log-rank test is commonly used in survival studies to compare survival curves between different groups, such as patients treated with DFMO and those in different risk strata. And in my opinion, the test was suitable for this study, which involves long-term follow-up and the comparison between groups of patients with different risk characteristics. The limitation of the methods chosen include the fact of the study is a single-arm trial with no randomized control group. And this is my presentation. Thank you so much for watching. And that's it. Bye.